strong memories about the impact of the School of Public Health. Many faculty members in the School of Public Health went out into the community to study HIV. Suddenly people were dying. Some people had the belief that it was because of witchcraft. We used to overhear then say, oh, this man, he has come to say farewell to us. Tomorrow he will be no more. And we were wondering what it meant. It was after a few days that we learned that people who were desperately ill and they didn't want to suffer anymore, they decided to take their lives. And we were told many people would swallow the battery of the watch batteries. They swallow it in the evening, and tomorrow morning it's gone. I must say the Rakai story was a masterpiece, because people were very eager to talk to us, they were comfortable. During our studies trying to see how much people knew, we got the apparent message that most people thought AIDS was witchcraft.
On the occasion of the celebration of 70 years of the School of Public Health at Makerere University, I want to congratulate the school on this major achievement. The School of Public Health is easily our flagship as far as research and community engagement is concerned. Since its inception, the school has definitely contributed a lot to enhancing public health around the country. There have been many projects. I can give very many examples, but let me just say, on the onslaught of HIV, the school was quite pertinent in looking for solutions for the control of HIV. With the professors like Rhoda and others, they were very instrumental in making sure that the country makes the right decisions in the fight against HIV.
One of the most memorable achievements I would like to highlight for the School of Public Health in the last 70 years is the establishment of Masters of Public Health program within the school. It started as what we used to call Public Health Without Walls, simply because this program was the first program we are aware of in Uganda, in Africa, that did its master program in public health, trained outside classrooms. That's why it was called Without Walls. 75% of the time, the candidates were staying in the community as part of the district health team to be able to have the skills and competencies that we had designed by practically working in the districts. So it was an apprenticeship program. This was a huge departure from the usual way of teaching public health, which was men who come in and sit in the classroom. That was only left for only 25% of the time of the students to be. I would like to think that the impact this kind of training did on the students was extremely remarkable. I mean, when I look at the graduate of this program and where they are, they have made a tremendous impact, and I'm very proud of the product of this program over the years in terms of what it has been able to achieve. This program was initially funded by Rockefeller Foundation along with CDC, and in terms of implementing it, we tended to have input from Makerere from John Hopkins School of Public Health and Center for Disease Control. And I think this program really is a benchmark of training in the communities, with the communities, for purposes of impacting lives in the community.
Everybody would agree that our biggest impact started with the schools without walls, where Rockefeller invested a lot of money, especially the human resource for Uganda. We had that tripartite agreement between the Ministry of Health, Rockefeller Foundation, and the School of Public Health. At that time, we started as an institute. Now, the tripartite agreement simply meant the gist of it was every district in Uganda would be headed by an MPH holder. And we looked to serving every district, having a district medical officer with a degree in Masters in Public Health.
When I joined way back in 1993 as a graduate student, in my class of the M.Med Public Health, we were only 5 students. And those who came in for MPH were like about 7, or they were a little more. It was a small number. At the time, we probably had only 1 graduate training, a very small number. We didn't even have an undergraduate program. It was small. But we have kept growing. The MPH has been a great program because, as I said, the future of ensuring that community health, public health is promoted is through MPH. It's a great program that is contributing in terms of the management of health systems.
I think that notion, if it was kept going, it would have changed the whole country. Because we used to take students to other districts to help the districts organize their data, monitor what disease is coming up, so that we could actually monitor very early epidemics happening. I really wish, even now, that that concept of public health schools without war should come back. It helped us. We had a lot of funding, and that's when we went to research.
I couldn't believe we have been through 70 years of the school, but during this time, the growth has been phenomenal. Increasing numbers, increasing space, and increasing productivity. In the next 50 years, in the next century, what can we do better? I think we can do better in better identifying the talent that comes to the school, the talent that comes to the university, and we can do better in investing in this talent. What should we be teaching? What should we be mentoring these people into? And then also, what we can do better, how can we support this talent to go to the field and impact lives?
You know, as we look back to the 70 years and celebrate our achievements, we also have to look into the future to make sure that the future is as strong or even stronger. So there are several areas that we could look at into the future, but one of them is strengthening the methods that we use to generate evidence, particularly randomized control trials. Randomized control trials are a key design in the testing of both clinical and public health interventions. And we could improve this area in a number of ways. For example, capacity building, training more researchers, more scientists, so that we're able to continue conducting scientifically and ethically rigorous studies.
The story of the school is an exciting story. For me, it fills me with so much joy. Reflecting over the 70 years of the school and the stories that I have read, that shows a very, very impactful institution. The School of Public Health has done so much work, impacted so many people that have grown as students over the years, and many of us have grown up to be able to do a lot of work, both at national, regional level within Africa and at the global level.
As one of the students of the School of Public Health, I am very proud to be associated with Makerere School of Public Health. I draw a lot of strength, knowledge, and skills from the School of Public Health, and I am proud to say that the school has made me what I am today.
So the school has had so much impact on thousands of people that have gone through the corridors of this building and several other spaces where we have worked.
I, for one, Dr. Flavia Mpanga Kagwa, was a student at that school some time back when I was doing my medical degree training. And what a wealth of knowledge sits on that particular campus, with all the interconnectedness with both the south and the north.
I must say that the school did its best. Many districts up to now are benefiting from the products of the MPH program. Uganda, so far in the region, has more public health specialists or graduates at master's level than any country because of our program, the deliberate programs to address the problems in this country.
The School of Public Health is one of the excellence institution in Uganda, and I can be a real witness for that, because in our collaboration, the School of Public Health was able to provide us with expertise and evidence that would influence the policies we are implementing in Uganda.
For the last 20 years that I have been here at the school, I had a time when I was coordinating the MPH distance education program. And this program has made 20 years this year. And I'm honored, having had the opportunity to coordinate in the capacity of the academic and field coordinator for the last 11 years. And what can I say about this MPH distance program is that I've seen this grow over the years.
School of Public Health is the one school in the university that has the highest visitation index and international networks that have brought the university's stature to the global limelight. And we want to thank the leadership in the School of Public Health.
The School of Public Health here is the largest training institution in this country as far as public health matters go. There's a lot of potential. And this country, Uganda, just like other developing countries or low and middle income countries, but even high income countries, public health is of critical importance to the health of the people. Because it is cheaper to prevent diseases, and we should do that. Put great effort in prevention of disease, in promotion of good health, as opposed to the country putting a lot of resources into treating those who have become sick. Disease cannot be eradicated completely, but it can be reduced, it can be prevented.
We have deliberately trained, and it is on record. Ministry of Health and other countries will say epidemics in Uganda have been demystified. The Ebola outbreak, the COVID outbreak, Mpox, all these have been managed by graduates of the School of Public Health.
Personally, I've wished to thank the school for contributing to the training of people who we deploy in our epidemiology outbreaks, in the Fellowship of Field Epidemiology, who have contributed to the number of people who have been responding to our outbreaks. For instance, the Ebola outbreak, the malaria outbreaks, we've had the students and the fellows participating. And also we are excited to know that your continuous implementation science improves our programming as a ministry as we move from clinical research to public health research to implementation, then better programming. And then we are also able to measure the impact of our outputs and outbreaks.
So no wonder we can say and proudly say, and by the government to say that we are in charge of the health of our people as far as public health is concerned. And all this is because of the achievements of the School of Public Health.
We have decided to make the School of Public Health a standalone school, to have the status of a college. And we believe this should empower the school to do even more in research and community engagement than it has done before. Of course, I'm aware that the school, in partnership with the Karolinska Institute, have established the Center for Sustainable Health. This is a big innovation and a big initiative that is helping researchers to research on issues of how the environment affects the health of people and the health of animals. So I do believe that with the mandate, the new mandate of a standalone school, the School of Public Health is going to do even much more, do much more research, and particularly applied research, applying all the knowledge that we have, that we generate here at the university, to support our communities in order to keep the communities, to keep our country, and to keep people globally healthy.
So this is very exciting where the school is, but of course there is still room for growth, and we look forward to, even after 70 years, to see even additional growth.
Very excited to be celebrating with Makerere School of Public Health 70 years. And it's not just the number of years, but actually that 70 years has translated into many lives saved, many careers propelled, and certainly the face of public health in Uganda and the story of public health in Uganda really can't be told without mentioning Makerere School of Public Health. So it's huge congratulations to the school.
I thank the new dynamism in the School of Public Health, especially in the way they have tried to reshape the administration. But reshaping administration must be done in such a way that collaboration with other institutes in the world must continue. 70 years public health training in Makerere has been very, very successful, especially in infectious diseases.
But I believe that as we learn more and more over the years, we are going to do much better. First of all, I think we need to brand better. We've started on the journey well. I think now we brand better, we're better known, with products that are going out there that people see, and hopefully we can now do better, touch the Gen Z, the Gen Alphas and all that on social media, and ensure that they see the school, they want to be part of the school. It's the school they want to choose to come to. We also need to do much more in terms of research utilization, taking the university to the people to make sure it's not just a secluded place that is high level, but where people feel that this is our university. They feel that we need to ensure that people know that we are out in the communities, we are out in the districts, we are out bringing the research to the people that matter in making decisions right at the district level and also at the national level. But also explain better when we make the disseminations as investigators to the journalists in a language that they can understand, that is not full of scientific jargons, but is in a way that they can package this information well in the newspaper or on radio or on TV.
Allow me to say a big congratulations to the entire team at the School of Public Health and all who have gone through this school. God bless you.
So in that spirit, I think 70 years is a good milestone for us to celebrate with the school, and also to wish them even greater heights as they progress to aspirations beyond being just a school of public health, but becoming an international institution to serve the region.
And with the new policy, with the new development, which I strongly support. I was part of those advocating. We've been doing the negotiation when Professor Sewon Kabo was still the principal about the School of Public Health becoming autonomous so that we can grow, not because we are selfish, so that we can grow, expand the scope of public health so that we can serve our nation better with more public health professionals.
We at UNICEF appreciate the knowledge that exists within the school, and we partner on so many fronts, including enriching every child, making sure all the disabled children are brought into the fold, and we have inclusive programming with your help. I applaud and appreciate the work that's been done on that campus for the past years, and we are looking forward to the next 100 years.
At this celebration, I congratulate. 70 years is not a short time. To sustain a public health school for 70 years is a great achievement. But I am sure in the next 70 years and beyond, the Makerere University School of Public Health will continue making a mark in well-being of humanity. And I think Uganda is a place where a lot of discoveries has happened in public health, and it will continue enriching knowledge in public health globally and ensure that it contributes most of all to the well-being of Ugandan people.
I'm thankful that I'm part of this celebration that we are all, excited about, and so this is really to wish everyone an incredible time as we celebrate 70 years as the school, and congratulations to everyone.
I want to thank the leadership of the School of Public Health for really finding valuable partners that are brought in resources, both visible, human, and also institutional capacities to work with the university and, of course, continue working towards our agenda of being a center of excellence in research, training, and community outreach.
My very special thanks to the deans of the School of Public Health, because those being the top leaders of the school, they have given a sense of direction where the school was.
As the college, we joined the School of Public Health in celebrating this 70 years of achievement, of impacting health services in the country, in the region, East Africa, in Sub-Saharan Africa, and for being a leader of public health in Sub-Saharan Africa. And we celebrate with the staff and the students of the School of Public Health, and join everyone else in the country in celebrating this school.
Looking at the next 30 years, the School of Public Health may be the breaker of all the grounds that have not been broken. School of Public Health has built capacity that is not anywhere else in public health, in schools around, because I have interacted with many schools, but we have many scholars in this country that have studied public health, others have done PhDs. We can say we are the champion for the schools of public health in the region.
Early this year, we found that 85% of the staff in the School of Public Health are serving on a technical working group, policy level committee, within the Ministry of Health, within Africa, and at the global level. That high presence within the spaces where decisions are happening, where policies are being developed, and where programs are being reviewed and evaluated is so important in terms of giving us proper perspectives of where the challenges are, what is working well, what the gaps are, so that we can also make a contribution.
Public health is not just a simple science. It saves lives, and it saves lives in millions. And the public health school is at the center of it and influencing it. And we should continue doing that. And with the new advances, it also has to expand its contribution to global health.
It's just the beginning, yes. Because as we look to the future with more complex challenges, we need to work with colleagues across the technology, we have to work with colleagues across the behavioral sciences, the communication, very important in public health. We are now working with them as well to develop a joint program in health promotion and communication. So it's just but the beginning, and we are looking forward to engaging even more across schools and colleges within Makerere University.